Thanks, everybody, for coming here. Got a nice crowd, Marcus. So pleased to introduce Marcus Howard. He's the founder and CEO of GreaterHealth Pharmacy and Wellness, which is a healthcare model rooted in equity, access, and community trust. A native of North St. Louis and a graduate of Metro Academic and Classical High School, Dr. Howard launched GreaterHealth in 2020, and it directly addresses disparities in pharmacy, access, and culturally responsive care. It stands as the only Black-owned pharmacy in the state of Missouri. Since opening its doors, GreaterHealth has served thousands of its residents across St. Louis and addresses those who struggle with affordability and transportation barriers or distrust of the healthcare system. Offering free home delivery, individualized medication counseling, and on-site clinical services, GreaterHealth has become more than a pharmacy. It's become really an anchor to the city's public health ecosystem. Dr. Howard's leadership has earned him numerous accolades, including St. Louis American's Salute to Excellence in Healthcare, St. Louis Business Journal's 40 Under 40, and Better Family Life's Next Award. He previously served as the Regional Chief Innovation Program Officer for Teach for America. He holds a bachelor's degree from the University of North Carolina at Chapel Hill.
Go Tar Heels. We're everywhere, Deborah.
I know you are, hanging off the ceiling. Master's in Curriculum and Instruction from the University of Nevada and a PhD in Leadership Policy and Human Development from North Carolina State University. So I'm going to turn it over to you and Dr. Howard.
Thank you. It was quite the introduction. Good afternoon, everybody. Good afternoon. My name is Marcus Howard, and care for those furthest away from opportunity. So I was a little nervous when they asked me, you got a 40-minute presentation in front of a whole bunch of people. But no, I think I'm excited today to talk about GreaterHealth Pharmacy and Wellness and its public health in action. So I was really excited because just, being able to share, what we're doing as far as the public health ecosystem actually in action. And so it's so much to learn when, you're deep in the work and doing the work. So really excited to be here today and excited to talk to you all today. And so I'm really just going to take you all on a journey about first how proximity to the health inequities that exist in my community sparked the idea, being proximate to the problem. Right, and understanding the problem on a personal level and a sociological perspective level helped to spark this idea. Then leveraging storytelling and resiliency to raise the money to launch the idea. The idea cost $1 million, and so I had to go find $1 million to be able to spark to get this going. And then how prepared teams and responsive care created real access. So access is a term that a lot of people use, but you start to understand, when you delve deep into the work with specific communities, what access really means. And then taking a step back and understanding the challenges and success factors that shape the experience, right? Because at this point in juncture, there's a lot of opportunity going into the future with pharmacy care and with Walgreens closing across the state, specifically in the areas that we support. You start to understand, okay, if we can understand the challenges that we've had in the past and what has made us successful, when we start to understand that, we can understand how to really push forward into the new opportunities that exist. And then lastly, what does it look like, the intersection between WashU School of Public Health and GreaterHealth Pharmacy and Wellness? Hope it leads to a job, but, that's just, we'll talk about that. But no, and so the first thing, just going into proximity and what proximity does and how it sparks idea when you are experiencing something every day, what happens. And so on the right, that is me about several years ago. And that's my mom and my dad. And so my story starts specifically in public health in 2020 when the pandemic hit. And my dad was diagnosed with congestive heart failure. And so I was forced to move home and care for him. And so, every day I would talk to him. So he's digested with congestive heart failure. I think at a point in time, he said his heart, the doctor had said his heart was operating at about 10% capacity, and he wasn't doing well. The interesting thing was that he still wouldn't take medication, wouldn't take his medicine. He wouldn't listen to the doctor. And his family is like, I'm like, Dad, like, you either gonna listen to the doctor or you're not, you're gonna be out of here pretty soon. And so I thought that was so fascinating that even at the level of health that he was and his health was deteriorating, it was still so much distrust in medicine, distrust in the healthcare providers. And so he really, he thought that, doctors just want to they just prescribe stuff so, pharmacies can make money. They work together to make money and they don't care about you. And I'm not taking that medication. I think that was the first thing that sparked me. It was just like, this is fascinating, but exceptionally important in understanding how do I help my dad become healthier? So what became even more interesting, I wanted to understand not only, on a personal level, I started to go out. Now, I know this sounds academic, but it was. I went out into the community and I started to talk to people with chronic conditions, over 100 people in the St. Louis community. These people were across race, gender, ethnicity, country of origin, language, socioeconomic status. And I wanted to understand what was their healthcare experience. And one of the things that started to emerge was some of the same things that my dad was talking about. So I started to understand that this challenge was not just personal and it wasn't just in a silo. This was widespread and the magnitude of this was important. And what kept coming up was pharmacy. Take your medication, because it was so directly linked to people becoming healthier after they left the hospital with their chronic condition. And we started, and pharmacy access just kept coming up. And so some of the three insights that kind of emerged from me talking to these people in the community was that even when a pharmacy is closed, getting there without a car can be a major challenge. So there was a transportation gap where people couldn't physically get their medication. And then two, there was just a huge mistrust in the healthcare system. So no matter if it was an immigrant population that talked about the distrust and about how it was so disconnected from their native understanding of healthcare, whether if it was across genders, if it was across race, it kept coming up. There is a comprehensive distrust across a lot of demographics of the healthcare system. And so that's a challenge when people need to get healthier. And then third, out-of-pocket costs resulted in medications being left at the pharmacy. So we're looking at cost, we're looking at trust, and we're looking at proximity. That is where we started to understand that combination was access. And there was a lack of that. So it wasn't just, I can't get there or I can't afford it, but if I don't trust it, there's no access. I can get the medication right in my hand when I leave the hospital, but if I don't trust it, I don't take it, that's not real access. So I started to dive deep into what is going on as far as the pharmacy ecosystem in St. Louis. And the topic that emerged was pharmacy deserts. Anybody in here heard of food deserts? Everybody, raise your hand if you heard of food deserts. Raise your hand if you heard of pharmacy deserts. Same thing, right? So basically the communities that are experiencing food deserts where there's inequitable access to food, healthy food, fruits and vegetables, same thing with pharmacy. There's inequitable access to pharmacy services. And so with that though, with inequitable access to pharmacy services, what happens to a community that doesn't have access to a pharmacy? So what happens to a community that is experiencing a high overrepresented in having chronic diseases that they're managing multiple, whether it's high cholesterol, diabetes, hypertension, congestive heart failure, like a lot of these things. What happens when they don't have access to a pharmacy? Because all of these things you need to take medicine to get better. What happens is those conditions worsen. And then what happens after that is medical bills worsen. And not only do families suffer physically, but also they start to suffer financially. And so what we started to see was kind of like an example of a story where Robert was he had hypertension and had no car and lived more than a mile from a pharmacy. So he lived in a pharmacy desert. with no way to get his medication, he went 3 months without his blood pressure meds, right? Worsening. So then his blood pressure got out of control, and then he had to go to the ER, and now he can't afford to pay $1,300, right? And so now you have a real problem. And we also learned that Black St. Louisans are hit hardest. 53% of Black residents are stuck in pharmacy deserts across the St. Louis metropolitan area. That is a silent public health crisis. However, almost a large percent of residents in general are impacted by pharmacy deserts. So that's why this is so important, because this is across a lot of demographics. This is not just one particular, because it's not just access, it's trust. And there are a lot of cultures that don't trust modern medicine. And so there's a lot of things that go on with that. And so we started to really understand, and these are the numbers that show that this is a real problem. 45,000 residents have no pharmacy within a 1 mile radius, 45,000 people. And then 160,000 people live over a half a mile from the closest pharmacy and don't have necessarily adequate transportation. And so, you kind of see the numbers to the impact that a pharmacy desert has. And so it's a very important problem, and the magnitude is immense. And so that is when I said, hey, it might be a good idea to start a pharmacy, because pharmacy is at the center of all healthcare conditions. A pharmacist, interacts with insurance. The pharmacy interacts with doctors, all providers, dentists, everybody, hospitals, clinics. And so it was, and what's a lot interesting, a lot of people don't understand, is pharmacies interact with people once a month or every 3 months. So there's really no other healthcare provider that can really have the greatest impact on a population than a pharmacy. Pharmacy is really the most accessible healthcare provider. Anybody can walk in a pharmacy and talk to a pharmacist about a healthcare condition, about medication. You can't walk in a doctor's office and ask about, a health condition, right? You can't just walk to talk to a surgeon or a dentist at that. But you can walk into a pharmacy and say, hey, and talk to your pharmacist about the medication. And so it's one of the most accessible healthcare providers that there is. And so there's a huge opportunity to improve healthcare outcomes in the community with a pharmacy at the center. Right. And so this was my vision, big vision, big mission, to provide affordable, convenient, and trusted pharmacy services to eliminate pharmacy deserts. The reason why I think everybody understands affordability, everybody understands convenience. But again, the reason why trusted is there is because that is the underutilized aspect of access that we don't talk about, trust. And so the vision is, if all people can live with a community with access to quality pharmacy services, they can be on a pathway to a healthy and quality lifestyle. Right. And so this is how we were going to do it. Patients would go to their healthcare provider, and then they would be prescribed medication. So we have to really understand the process of how a pharmacy works. Right. They get access they get the prescription sent over from a healthcare provider. Then we get it. A patient profile is created. The patient is categorized, insurance or no insurance. So we have to understand that, because that's the cost aspect. Geographical location, that helps us understand how convenient it needs to be. And then type of chronic condition, right? What interventions we'll need to provide in order to support these people. And then the last thing is the pharmacy delivers these services. So the 4 main services, or our core program of the pharmacy, are wellness calls. Can anybody think about why we do wellness calls? A little bit of interaction, a little bit. Anybody? All right, I'll tell you. I'll just keep going. But as a teacher, I would wait in the awkward silence. But wellness calls helps build trust. Wellness calls, when somebody calls you just to see how you're doing, that starts to build trust. And trust is a major component in building access to the populations that we're looking for. Free home delivery, that solves the convenience issue. 95% of our patients get the medicine delivered right to their door. So that helps them get access to that chronic disease education. So so just like a doctor, a pharmacist has deep experience in chronic disease education. They understand the chronic diseases and they can talk to people about them because they have to talk about the medication that interacts with them. So they're experts in that. And then virtual medication counseling. So a lot of our patients thought, hey, I should go to, and I don't know if, no shade to any physicians in here, but when a patient really wants to better understand medication and the interaction with food and exercise and diet, the pharmacist is the expert, right? They're the expert in medication, right? They're the experts in understanding side effects and things like that, and then the most accessible to talk to. Right. And so understanding that these are the services that we felt like we can complement to the physicians, right, and take it off their plate and specialize and fill that gap, right, where everybody is doing a lot of things. We felt like we can specialize in that and provide those services. And so with those services, and this was just our idea, was that we could take this model, provide these core services, and start to eliminate pharmacy deserts and ultimately improve health outcomes. Again, huge vision, huge mission, but that was the goal, and that's what we felt like we could do, and that was the direction that we wanted to go. So now that we have the vision in which we had the plan, you can see how we didn't know that this was gonna work, but this was our plan, and this is what we wanted to do. The next thing is we got to raise the money. Healthcare is not cheap, right? It's not cheap to build a healthcare facility. It's not cheap to run a healthcare company, and so you have to raise money. So we had to raise $1 million. Okay. I am from North St. Louis. I do not have a network of people I can just add. Hey, can I get 50,000 here, 100,000 here? I didn't have that network, right? And I didn't have any experience in fundraising. So the very first thing I did was I started a GoFundMe page, right? And again, that might sound silly to some, but it was the only thing that I knew how to do. Right, that was the only education or inkling of, okay, I've seen people raise millions of dollars on GoFundMe. And so I started a GoFundMe page with the goal of raising $1 million, and I raised $6,000. Right. But what that helped me do is I understood, wow, this was $6,000 from individual people who believed in what we were doing. And so we realized that we had something. Even though we didn't raise $1 million, we raised enough money to show this is important and people think this is important and we have something here. So it was the encouragement that helped me build some resiliency to then go on and start to the fundraising process. And again, I am learning as I go. I am what you call building the airplane as I go, even with fundraising, right? So understanding how do you fundraise? How do you tell a story that gets people to buy into your vision and actually fund it, right? So a lot of people might, oh, we love that. That's important. Can I get some money? And so that's the big challenge, right? And so this was our first collaboration with WashU's Brown School in the evaluation. So I went to them to create an evaluation to say, if, in order for us to raise money, we're going to have to show not only how we're going to make a financial return, but what type of impact we plan to have, since this is such a huge problem. And so what happened was we started to talk about how we were going to increase access. So when I talked about trust, convenience, and affordability, we wanted to be able to measure that. So this comes later in the presentation, when we talk about what intersection we can have with institutional partners, but this was the plan. This was the research plan. And nothing goes as planned in entrepreneurship. So but this was the big plan. And then if we increase access, we would improve quality of life at scale. Then ultimately we would eliminate pharmacy deserts and reduce health disparities. So this was the plan that we sat down with the Brown School and created. And that allowed us to sit down with funders and tell that story of this is not only the impact, this is not only the financial return we will have, but we would also have a major impact in the space. And so not only would it be a impact, but there's a business case to this. So there's no way you can go to an investor and talk about a whole bunch of feel-good things that, yes, are true, but investors want to know what is the business case for this plan. You're going to help people, but in order for it to be sustainable, there has to be a business side to this, right? And so we learned that, hey, I mean, in the U.S., pharmacy is a huge industry. In Missouri, it's a $3 billion industry. And then even just in St. Louis, it's a $100 million business opportunity right here. So the business case is there. So we literally devised a plan of 80 people, of potential investors, to reach out to. Doing the same thing I'm doing with you all. I'm telling the story. This is the problem. This is how many people it impacts. This is the greatest plan that God ever made, right? And so what started to happen was we started to get no's. No, bad idea. No, bad idea. There's a Walgreens and a CVS on every corner. Bad idea, bad idea, bad idea. Once you get 30 bad ideas and no's, and then you go to 40, then you go to 50, then you go to 60, you start to reconsider, is this a good idea? So that's why the title of this part is Storytelling and Resiliency, because there's a certain grit that you have to have when you're starting something new, right? And a lot of people are not going to have that vision. I mean, you can understand now with every Walgreens closing on the corner, now everybody's like, this is a great idea, right? But when we first started, nobody saw that. And, and it wasn't people felt it wasn't a good idea. So we were up to about 78 no's, like literally pitching this 78 times and everybody saying, no, bad idea, right? And so, I did have some people who were business people in the business community say, keep going, this is a good idea. Because if I probably didn't have that, I might have just took it back, so because you don't want to be, irrational. But there were business people that said, you should keep going. This is a good idea. You'll find the right person to connect with. And so we found the CEO of the Missouri Foundation for Health. So a lot of you all might not know that the Missouri Foundation for Health is a state foundation that focuses specifically on health equity. And so not a lot of people knew about that foundation. And I just knew because I was telling Delmar this morning, I just was reaching out to people. And then people would send you here and people would send you there and you just keep reaching out. So there's also a level of vulnerability where you're spilling your guts and people, you have this personal idea and people saying, bad idea. Are you smart? I thought you had a PhD, you should know that, and so you keep going. And then you just, and just pure numbers, the CEO of the Missouri Foundation for Health was the 79th person I had talked to. And the CEO said, this is a great idea. My foundation has $1 billion and we can 100% fund this. Then I said, well, I'm from North St. Louis. I don't have collateral for $1 million. If this don't work, I don't have $1 million to pay you back. And what they told me was, that's okay. We believe in this vision. We believe in this project, and we're going to give you the money, and we're going to partner with you along the way to get this done. And so that was when we opened up GreaterHealth Pharmacy and Wellness in the Delmar Divine. We got the money, and we built this pharmacy that was in what's called right now the Delmar Divine building. Which is a revitalized, was a vacant hospital that was revitalized by the founder of Build-A-Bear. And we got a space here that also signaled like a historic space for healthcare for the community. So it was also symbolic a little bit where the building was no longer a hospital, but our pharmacy could still be a symbol of healthcare in that community. And so we reached out to every major academic institution and hospital. And I mean, SSM, I'll say it lightly, SSM said, yes, we will partner with you to provide additional healthcare services in your pharmacy. And so, again, what we wanted to do was to make sure that we knew transportation was a problem. We knew access to providers was a problem. So we wanted to create an experience where people from the neighborhood can come in, go to an express clinic, get diagnosed from a nurse practitioner, and then go get their medication. And then in one swoop, they can be back home and they have everything they need to be healthy. And so they believed in that vision and they invested in a space. And so we opened in 2022. let me take a break. All right. And so this is what the inside looks like. And so it's a very community field. It's a small space. And basically we wanted to make people feel connected. And one of the things to make people feel connected is to create a small space. When you go to Walgreens or CVS, it's huge and it's informal. And that creates an environment that is not necessarily trusting. But when you come in, and as soon as you come in, the pharmacist is not too far, and the pharmacist says, "Hey, how you doing? How can I help you?" That changes the experience, and it changes the interaction that people have in the pharmacy. And so it has a small OTC space and a pharmacy team, and you can see like the language that is not just that's coming out of the people's mouths, but the physical environment. As you see, you are a valued member of our pharmacy, of our family, is at the top of the wall. And that's so you can see what people see when they first come in. Again, is to continue to build, trust. And then over here on the other side of the wall, it says everybody is welcome, right? So those are the types of things that people see in the healthcare environment that make them feel, wow, I am welcome. So no matter the race, the gender, the political affiliation, and we have a lot of people who feel comfortable coming and knowing that they're going to get the best service from a pharmacy. And so once we have it built, right, you think we've raised $1 million, we have this pharmacy built. Now we have to do, I didn't realize, the hardest part of running the organization. We had to hire the people. Just a heads up. People, the business side of it, the raising money, I realized was the easiest part of this journey. Getting the people who believe in the vision, people who want to work as a team, people who want to provide patient-centered care, people who want to come every day and work to create real access was very difficult, right? And so right now, this is the picture that everybody sees. Oh, great team. It's a collaborative team. This is actually our chief pharmacist right here. He came to show some support. And so this is the team everybody sees on the flyers now. Oh, and I can go out. Oh, wonderful team. This is such a great team. They're so dedicated. I went through about 3 or 4 teams before I came to this, right? So I thought I could look at a resume. Oh, person got 20 years experience. They are going to be great. 20 years experience. Oh man, they know pharmacy. They come in. They are jaded by Walgreens and CVS. So they're like, okay, yep, nice to meet you. And I'm like, whoa, that's not how you build trust. And there's no difference between a Walgreens and CVS and us now, right? And then it's like, oh, we have a vision, but you have 20 years experience and you're not listening to nobody else. Not quite the person that we need, right? And then we go to different team members, and I'm learning. I'm like, wow, this is the hardest part. Getting the right people to get on board is the hardest part. This was by far the hardest part of the journey. Specifically for me, as you're leading an organization, it's a new vision. And so you don't have a lot to stand, if you're from a larger organization, we've been here for 20 years, you have a lot to stand on. My sale was, we're going to get there and you got to follow me. And I'm not a pharmacist, right? And so that's a hard sell, right? And so you have to do other things as a leader to get people's buy-in and to build trust and to get really people, involved. And so finally, I asked for help. And I was like, I went to some community partners and I said, I need help finding the right people. And I'm not good at it because I keep choosing, resume great, or this person has experience here. And I'm only looking at paper and not understanding there are other things that you have to look at and analyze in order to find the right people. So I created a community advisory board, and that community advisory board went through so many people, and we finally got people, and it's almost like magic. I'm like, that's all I had to do? What somebody would have told me, right? But it was just like why collaboration was so important. Because the things that you're not able to do, other people are. And once you bring them into the fold, you're able to be more successful. And so this was the team that really came together. So this is the 6 months after we opened. So in 6 months was the most tumultuous time that, firing pharmacists resigning. Like you're trying to find that alignment, and we finally did. And that's when we were really off to the races. And so I'm going to play you 2 videos. And they're really just to show you the type of impact. Just to also, you don't want to hear me talk the whole time. It's better to hear some video that the impact and the services that we're currently providing.
And it's like when you get a certain age, it's like they put you in this grade.
For so long, 86-year-old Gwendolyn Favas felt like her doctors just didn't care.
Because they didn't pay no attention. There's no communication with the doctor. They don't talk to you anymore.
For years, she's been on Medicare, federal health insurance for people 65 and older. She felt like a number with too many medications.
This is my Coumadin.
27 to be exact.
I don't even know how to pronounce it half the time.
How you been doing?
For conditions like lupus, heart disease, and arthritis.
Take your time.
Her nephew and caregiver, Patrick O'Neill, was bracing for goodbye.
My aunt was literally lying, sitting in her chair like a vegetable.
Everything changed when they came across a different type of pharmacy.
Would you say GreaterHealth Pharmacy saved your aunt's life?
Yes, they did. Yes, they did.
Providing culturally responsive, radically inclusive services to a diverse community is really important.
Marcus Howard is the founder of GreaterHealth Pharmacy in the West End.
In order for have to bridge
Deciding where and how to open his pharmacy. Researchers have found about 15% of people in the city of St. Louis live more than a mile away from a pharmacy. Others lack access to transportation.
Go ahead, sit down.
And others, like Favas, don't feel listened to. So they skip medication. Their health suffers.
They feel more comfortable calling us, talking to one of our pharmacists. Sounds like they connect.
Research shows people on public insurance can suffer the most. Fewer physicians accept Medicaid, for example, health insurance for people with typically lower incomes. Doctors who see Medicaid patients also generally get paid less. That can impact quality. Doctors have less time to spend with patients. Here, a pharmacist sat down with Favas for an hour to go through the medications.
They make you feel like you are special. They make you feel like, these people love you.
Hey, how you doing, Miss Jackson?
They offer free delivery.
Thank you so much.
In fact, Howard, he says he's looking for and believes is the reason his.
And so and really the point of that video was just showing you the types of impact, like with the right team, when you get the right team and the impact that we're currently making. And this one was also a very interesting video as well, and we'll hear.
GreaterHealth Pharmacy is making a huge difference for those living in pharmacy deserts. And now this new program is helping people not only get their prescriptions, but also fresh food delivered straight to their doors. There's something different about GreaterRx, a pharmacy that touts itself on being inclusive, from who it serves to how it serves.
Understanding that around 50,000 pharmacy residents
That delivers So it was a no-brainer that a pharmacy that delivers might also drop off food as medicine.
And we're able to distribute it to a lot of our patients who are experiencing hypertension.
We pack the bags with nutrient-dense foods. Our nutrition specialists collaborate with the pharmacists from GreaterHealth to discuss what is good for those with chronic health conditions to help them manage their symptoms.
Operation Food Search comes up with a specific food box each month to coincide with monthly medication deliveries. It's an innovative yet common sense approach to solving a shared problem across communities.
These patients are across lines of different.
They are. And let's get back to it. And so that is where, and so really GreaterHealth, what it is now, it's so right now the organization is serving about 3,000 patients a month in providing medication delivery and food delivery. Because as I talked about before, as communities that are in food deserts are also in pharmacy deserts. And so this is just really quickly this is just the ability to stand back and see, okay, there's a huge opportunity now. But understanding the challenges, what were the roadblocks that made this difficult? And what were some of the things that made us, created some success? And so try to go these these are really, really important insights, and it could have practical application for people doing public health in action, going into the community and actually doing the work. The first one was, who shapes what's possible. And which means that, knowing people, having connections to people who know, who know investors, who have institutional connections. That's really important when you're trying to build something like this because it takes so many partnerships. So who you know is very important. And if you don't know a lot of people like I didn't, a lot of the work is not only building the business, but also building relationships and building a social network of people to help further this work. Also, this is from a policy standpoint, something called pharmacy benefit managers. Has anybody, raise your hand if you've heard of PBMs. PBMs have been in the news quite often because they're an intermediary between insurance companies and pharmacies, and they're squeezing smaller pharmacies, the margins on smaller pharmacies, by taking some of the money that the smaller pharmacies are supposed to have. And so that's a policy issue where the reimbursements are not as large, and it's harder for smaller pharmacies to make a profit. So understanding that that policy landscape is important when you're doing business in the pharmacy space. Pharmacies are doing public work without public health investments. Money. In order to get, to scale and to keep it going, this type of work takes money. However, it's not necessarily attractive to most investors. It's not high tech. It's not, it's not going to get you a 10x return in 3 years, but it is something that's very important and at the core of public health. So it's very important. And so, trying to find a network of people who will invest in something like this to scale it to fill a gap is very important. Whether it's philanthropic, whether it's private, whether it's public, finding that network that really doesn't exist right now has been a barrier. Hire for alignment, not just skill, vision-driven teams build what resumes can't. I did not know that. I was looking at resumes, right? And not understanding that you have to hire for alignment, people that want to work together, people that have the same vision and the same mission. You got to find that, because if you don't, you can't get started. You can't move forward. You gotta find that team. And then there's no clear on-ramp. Community pharmacy struggle to partner with institutions. So I think this is interesting because in order for smaller organizations and pharmacies to be successful, they have to partner with larger institutions, academic institutions, hospital systems. But those institutions are not used to partnering with smaller pharmacies. And maybe too, because they don't know what value a smaller pharmacy can bring. And so that is what was interesting when you learn that, but it's also an opportunity, right, to educate and begin to partner. Some of the factors that worked and shaped success was reimbursement rates for Missouri Medicaid. So Missouri Medicaid, this is another policy factor where Missouri Medicaid is one of the most generous Medicaid programs in the country. And the next most generous is California's Medicaid program. And so, for pharmacy, on the pharmacy side, not the provider side. So as the pharmacy, they allow you to address, as a pharmacy, social determinants of health and get reimbursed for it at a really high rate, allowing you to provide additional services to allow your pharmacies to be sustainable. And so that's important because the people who need it most, the pharmacies can afford to do it because they get reimbursed for it. And so that is a very important policy aspect that allowed us to make it to this point. The system gaps. So with the Walgreens closing, there are people to serve. So there's an obvious, clear indication of a need there. Mission-aligned teams are the backbone. A great team. I cannot stress you have to have a great team to be able to do mission-driven work because it's hard, it's difficult, you're navigating ambiguity, and you're doing a lot And so you gotta find the people that are mission aligned. And then responsiveness builds trust is the fastest way to show people you're listening. So a lot of that you saw in the videos was a response to the need. Food desert. We produce food. People don't have transportation, so we deliver it. We do counseling because people have chronic disease conditions. So when people see that, they start to build trust with you. Hey, you're here to help. You're just not focused on giving me medication. You care about my well-being. You start to build trust. You start to bridge access. And so the very last thing, kind of my little, pitch, WashU School of Public Health and GreaterHealth Pharmacy, it really just very simple. That there's just opportunities. And so one of the barriers, though, is that smaller pharmacies or institutions like that don't necessarily have always the ability to partner on an institutional level, but there are huge upsides to doing so. One is research and evaluation. So you all saw that big evaluation plan that I showed you on a few slides. We don't have the capacity to actually implement that rigorous evaluation, right? As you have a team that's focused on doing the work, it takes additional resources to actually do the research and evaluation. And that's where an institutional partner can come into play and help provide that research and evaluation so that bring in grant dollars, continue to fund and scale interventions that work, that are community-centered, that are reaching the people that need help. Like I said, grant partnerships, and then innovation and intervention pilots. So if the School of Public Health is developing food interventions or chronic condition or working on health communication models, and they want to test it with a healthcare provider that sees a patient every month and can see some outcomes, that could be very valuable because GreaterHealth or organizations like GreaterHealth are with the population that need help, the population that's historically marginalized, furthest away from opportunity. So there is a huge, huge opportunity for larger organizations to rethink how they partner with community-centered pharmacies or other community-centered healthcare providers that are in the space doing the work. Whew. That is the story of public health in action, the story of GreaterHealth. And so, again, I am very, really excited. Didn't even know 40 minutes was going to go by that fast. But very excited to just tell you all the story of what it looks like for us to do work. But one of my things is research and practitioner partnerships. Because if we had research evaluating the outcomes, and then we go back and take that research and improve our practice, and then do more research, and then and improve the research. Like there's a cyclical relationship that can happen. We can really improve the outcomes for people who need it most. And so, really excited just to be able to share that with you all today. The hardest part of my day is over now. Now I can just listen and talk to people and I don't have to worry about this presentation. But no, very excited just to be here and to open it up for questions. That was a lot. But we'd love to open it up for questions. Just questions about anything pertaining to this presentation. Yes, sir.
So you alluded to this last week. The Walgreens in the Penrose neighborhood closed. Mm-hmm. Next week, the Walgreens at McCaughlin and Manchester will close. Yeah. So how do you why are they closing, and how does GreaterHealth avoid the same fate? Give us some insight into what's happening in the marketplace.
That's a great question. I think so. They're closing in specific neighborhoods. So that's the thing too. So they're not necessarily just closing in one or two neighborhoods or all neighborhoods. They're closing in specific neighborhoods and this is what they said. So again, I don't have any specific insider knowledge, but what they're saying is, hey, we're closing in neighborhoods where there's a lot of theft and there's a lot of the reimbursements are low. And so for us, though, I think we're more of an agile model and we're coming in understanding all of the challenges. So just think about I think it's like a visual where like a cruise ship is hard for them to pivot in the midst of changing reimbursement rates and changing, behavioral trends. But for us, we can come in and say, okay, we make money here, we make money there, we make money with this population, we provide these services, and we can start at a position of understanding and understanding the market in a way that a Walgreens that has been here for almost 100 years has been operating. It's hard for them to shift and pivot into how things are reimbursed now, what communities want, and things like that. And so, I think that is really simple, because then you got CVS that's still worth $150 billion, right? And so, but they are also pivoting to smaller pharmacy models like ours. And I think what we do well is we stay small and agile, and we deliver, and we're efficient. Right. So we don't have, a big 5,000 space that the building's worth $5 million. The real estate, the rent cost is this. We fill prescriptions, we get them delivered, which also creates an efficiency in our business model where we don't have things waiting on the shelf. And so I think it's just the efficiency of the business model that keeps us competitive, and our understanding of the business ecosystem, how it is now. And we're not adjusting to anything. We're actually coming in, responding to what the situation already is. Thank you. Yes, no problem. Yes, ma'am.
So great presentation. Thank you. First of all, as a physician, I agree with you. I actually think pharmacists are way better. Matt kind of stole my first question, but maybe just to add to that one, you didn't know it. So but I was actually looking at the financial documents, because I know that Walgreens is actually going private. So it is a larger market problem. And I think CVS is also, as I said, they're struggling financially. So just to confirm, is your model fully for profit, or does it have like a nonprofit component to it as well? I just wasn't.
No, great question. No, it's a for-profit model, but it's just a model that is focusing again, like a new company in a market. So it's similar to, it's similar to like the Blockbuster and the Netflix example, right? Where Blockbuster has such a model, and then they're trying to pivot. Where Netflix is coming into the age of streaming, and that they're responding to what is current, right? And so if you got two giants that are now have to respond to the market as it is now, is difficult, right? And so that's really, the major, and then if you're building a pharmacy in that model, you're building it based off what the reimbursement rates are now and what the opportunity is now. And so you can create a sustainable model on the front end, and you're not pivoting like a lot of those larger organizations.
So then just to follow up on that, and I didn't know about the Missouri reimbursement rate. That's great to see. But I know in the recent budget, there is actually a potential cut to Medicare. And I know Senator Hawley, because how Missouri, actually, there is a lot of investment in Medicare here. He's fighting to make sure that doesn't happen, at least from what I read. So my question is that part of your conversation? Are you trying to work maybe with the senator or others, because Missouri would be hit hard, especially the pharmacists now? And would that affect your?
Yeah, there's no, the cut to for us, cut to Medicare would impact us. The cut to Medicaid would have the biggest impact to us, because the cut to Medicaid is going to impact hospitals, federally qualified health centers. So it's like, the cuts are going to hurt anybody in the healthcare space. So it's just like, it's really nothing you can do but wait and pivot to see what happens. Because I can't lie and say we'll be immune to that, because every single healthcare institution that takes Medicare and Medicaid, and those are in communities at hospitals and health centers that take care of those populations, they're going to be significantly impacted. And so will we. Right, because our population is 60% Medicaid, right, and so we just hope, you just kind of, brace and just hope for the best, and just hope that maybe it gets dinged, but it not totally taken away, because something like that affects hundreds of millions of people, and so you just hope that somebody has a heart and just decides that. Okay, maybe not that, so that's what we hope. So we just hope for the best. it's all you can do as a business owner, like, or a leader in healthcare in general, in research, all you can do is just hope for the best. Yep.
I really
enjoyed your presentation. I think, like, you mentioned the component about like pharmacy deserts. And I think the special thing that I was thinking about was the fact that not only do you address like the neighborhood discrepancy in pharmacy, but there's also a cultural shift.
Yeah.
Or there's a cultural component to Black people in particular. You're in the West End, so that's on the other side of the Delmar Divide.
Yeah.
They don't want to take medicine like you do where you're at.
Yeah.
So like, how do you foresee potentially WashU being able to maybe collaborate with what you've done and what you know to kind of dispel some of the historical mistrust around pharmaceuticals and medicine? Because doctors are busy, they're not.
Yeah.
Like, how do you foresee that gap or that bridge there?
Yeah, no, that's a good question. I think some of it is health communication and the health communication research, right? Because it's how you communicate with people. So, Dr. Powell, who's, one of our chief pharmacists who interacts a lot with the patients, the way he interacts and the way he communicates in a way that builds trust is important. And we train for that and we build people to do that. So, a collaboration or, WashU could help with understanding the communication that it takes to change behavior or to build trust. And I think that's through communication. It's how you communicate. You saw on the picture on the wall, the painting on the wall, you were family. That's the type of communication, right? Hey, how you doing when you come in? That's the type of communication. We answer the phone. That communicates that you are valuable, that we're not just gonna let it go to. So I think building research around how we communicate to our constituents, I think could be a collaboration to really understand that and really understand how that, because we don't have any really research and evaluation around that work. We just know it seems to be working. But again, you have those formative things that you see, such as reviews on Google, and you look at certain groups on social media, and you kind of see what are they saying about us, right? And that's kind of the assessment that we have right now, but we don't necessarily have a rigorous assessment around how is this communication that we do, how is it changing behavior in a way that's improving outcomes? Great question, though. Yes.
Thank you, Marcus. That was really exciting and inspiring presentation. So I was immediately intrigued by what you said about people visiting one time per month, and the opportunity that provides for public health, sort of interventions for positive behaviors and so forth.
Absolutely.
We think about that with nutrition during prenatal care, for example, or well baby visits.
Yeah.
Are there other ideas that you have for, ways to intervene for public health?
Yeah.
Impact vaccinations?
Yeah. No, absolutely. I think to that point, when you're able to see your patients once a month, there is a huge opportunity, right? So you're looking at health screenings, you're looking at point of care testing, you're looking at vaccines, you're looking at health education, you're looking at just really a coordination of care in general. So that's kind of like a lot of the things we're looking at right now. Pharmacists are able to do mental health screenings. So now, the pharmacist are able to, to delve into mental health. So there's just so many things. I mean, you could create wraparound services around that once a month, centered around the pharmacy. So we definitely are looking, but again, that takes resources. That takes more resources. That takes more people. That takes more money, and to be able to do those things. But we absolutely are.
Yeah.
No, Gregory, thank you.
I'm going to have to stop you because you have to get to the dean.